Hi, Mike Gibson here with Walid Saliba, Director of the Atrial Fibrillation Center at Cleveland Clinic, and we're talking about the next generation of the Watchman device. Walid, in some of the discussions I've had with you, you've talked about how this next generation device, there is a reduction in thrombogenicity with the new coating, yet there is rapid endothelialization of the device. I was eager to learn more about the mechanisms, and I'm excited to hear that you've been doing some work to understand how this was possible.
Yes, thank you very much, Dr. Gibson. This we have talked about, as you mentioned, that the next generation Watchman device has the ability to reduce thrombus formation without necessarily interfering with the healing process of the endothelialization on the surface of the device. Uh, there will be some work done in the future and will be presented in terms of the mechanisms at the molecular level that will be looked at. What we wanted to do as a next step is look at the histology. And is there something that happens right at the beginning, right after implants, that explains in some ways why do we have reduced formation of thrombus in the next generation device, and how does it work in terms of promote the healing process? So this next experiment was again with canine dogs that were implanted with 5 were implanted with the WATCHMAN FLX and 5 were implanted with the next generation device. And these were we looked at we looked at the device at 2 time points, at 3 days and at 14 days. And what was looked at was what is the degree of inflammation that was present around the fiber bundles of the fabric of the device at 3 days and at 14 days, and how does this correlate with the level of thrombus formation as well as with the healing process, keeping in mind that 14 days is an early time for healing. And what was found is very interesting, is that at 14 days, there is inflammation around the bundles of the fabric in both groups, the current classical and the next generation, but much less attenuated in the next generation. And remember, we're talking about a small number of canines, so we have to be careful about how we interpret statistics. But from what have been seen, at least a 7-fold reduction in the amount of inflammation in the next generation device around the bundles. And when we talk about a decrease in inflammation, we're talking about pathologists taking several sections through these fabrics and looking at hundreds of these sections and classifying them as severe inflammation or not severe inflammation. So the percentage of severe inflammation was significantly higher in the current WATCHMAN FLX as compared to the next generation device. Now, when you fast forward to 14 days, you see that the level of inflammation has abated in both groups. So that was good. But when you look at the amount of thrombus formation, at 3 days, there was at least twice as much thrombus formation in the WATCHMAN FLX as compared to the next generation. And that was still consistent at 14 days. The amount and bulk of thrombus formation on the current device compared to the next generation device is bigger. And actually, if you measure quantitatively the thickness of the thrombus on the surface of the device, it's also at least twice as big in the current device as compared to the next generation device. So the question becomes, well, despite the fact that we have more thrombus formation in the current device, and is this related to this early inflammatory phase that we see? Or is there some other processes going on that we have to explain? So that is what the field is going through, and this is where some of the mechanisms on the molecular level are going to try to tell us down the road.
So, a more prominent and aggressive inflammatory response in the old device. Perhaps, we don't know, but you're investigating whether that prompted more clot there. What about the next phase? What about endothelialization? When do we think that's happening? Is that happening somewhere between 3 and 14 days? Do we have any sense about when it's kicking off and how the inflammation is related to the
Sure.
endothelialization?
So one of the devices in the next generation device that was looked at showed the presence of the very glistening tissue that is consistent with early endothelialization and was actually looked at and confirmed by microscopy and histology. So it looks like there is an early endothelialization of the tissue that was observed in the next generation device that was not present in the current WATCHMAN FLX device. So as you said, early inflammatory phase abates by 14 days. Inflammation correlates with higher clot burden on the current device as compared to the next generation device, and definitely evidence of early healing and endothelialization in the next generation device, which makes that the next generation device with the current coating is really an attractive concept that merits a human evaluation in the near future. And if we can come up with a device that reduces the need for post-procedure oral anticoagulation, as well as reduce the risk of device-related thrombosis down the road, I think that we would have achieved really a great thing in the era of left atrial appendage closure.
So the reduced inflammation or inflammatory response may be the link to both the clot formation, reduced clot formation, and the more prompt and full endothelialization. Fascinating. Any other ways that reducing that kind of inflammatory response would benefit atrial fibrillation patients?
Well, that's an interesting question. We all know that atrial fibrillation is an inflammatory disease in some ways,
Right.
but whether specifically local decrease in inflammation using such a device affects atrial fibrillation per se is something that is still need to be looked at in prospectively in controlled trials. It's going to be we always talk about local therapy affecting more of a global disease. Whether this is going to be the case in this situation is something that we'll have to investigate.
While they're talking to you, you're the electrician, I'm the plumber. It reminds me a lot of our trip down, the drug-eluting stent development, where, we had different coatings and we finally found this Goldilocks solution of just the right amount of intimal hyperplasia to coat the stent to prevent it from being thrombogenic, but not limit blood flow. So, it's just fascinating to see all of this recapitulated again over with the WATCHMAN device. And you and your team have such great experience with this, as does Boston Scientific. Well, thanks for joining us today. Fascinating story, Walid. Look forward to reading more about it.